welcome. This is Elliott Garber, and we're here with the second episode of the Uncommon Veterinarian Podcast. I'm excited to introduce you to my guest today. Dr. Michele Jay-Russell is a public health and food safety veterinarian with incredible variety of experience in a lot of different fields, and I think she'll have a lot to share with us about her own career path and educational path. And so let's get going. Welcome. Thanks for joining me, Michele.
Thanks for inviting me.
Sure. Well, let's just start off. If you could tell us a little bit about what your current job is and what you're doing in that job on a regular basis.
Sure. I'm right now a faculty member. I'm in what's called the Professional Research Series at the University of California, Davis in the School of Veterinary Medicine. So in that capacity, I'm mostly a researcher, but I also do service, grant writing, and mentorship of students. And my specific area is food safety, and I'm a manager of the Western Center for Food Safety, which is an FDA Academic Center of Excellence. We're the fourth in the country and the newest of their centers of excellence. Our focus is on produce food safety, in particular the interface between animal agriculture, produce production, and wildlife.
Okay. Yeah, that's interesting. I noticed looking through your resume that you did have a number of papers and presentations involving wildlife species. And I think that people wouldn't really expect that coming from a quote-unquote food safety veterinarian. And so I would love to hear a little bit more about how you've gotten to be involved in the wildlife stuff, because I think that's something that's appealing to a lot of pre-vet and vet students and even veterinarians wondering how they can continue to be involved in some of those more unique species.
So because my emphasis since I graduated from vet school has been on zoonotic diseases, so diseases that are transmitted from animals to people, that's taking me in all directions. And with the food safety, when you look at outside of norovirus, which is just a human fecal oral transmission, all of the major bacterial pathogens, quite a few of them have animals as the origin. And a lot of them are food animals like cattle, but there are also wildlife reservoirs. And some of these produce outbreaks that go back to the fields, the orchards or lettuce fields are growing out in the open, and wildlife visit them and defecate. And so that has produced some potential food safety risk and given opportunities for veterinarians to provide expertise in terms of properly managing the risk. Okay. So we're not really, it's a little bit different in that, and sometimes we do run into some conflicts and concerns from wildlife conservation people, because there are situations where food safety is put in front of, for example, if you have a herd of deer coming into a field, the farmer is probably going to put up a fence and detour them from that wildlife corridor. And so an interesting opportunity for me has been to balance that in terms of protecting the but minimizing the amount of angst with having to interfere with the wildlife's natural movements.
Okay, that makes sense. So how do you describe yourself when you meet someone new? I know you say you're a veterinarian, but how do you qualify that?
Well, I actually do maintain my veterinary status, so to speak. So, for example, I do quite a bit of media outreach, and they always want you to identify what you are. And sometimes it's a little hard because I don't fit in. I'm not a professor. I'm not just a veterinarian. So what I usually say is I'm a veterinarian and food safety researcher.
Okay.
If I'm talking about program management, I may say that too, but I do intentionally try to get that out there that I am a veterinarian and that it ties into What I am doing is a little different than what, let's say, a food scientist would be doing that I'm working with. And I will say, though, that even though I've been at this for over 20 years, my parents still don't get it. They still aren't quite sure what happened to going into dogs and cats.
Well, that's a good segue. So did you start off vet school thinking you were going to be going into dogs and cats, or when did you first begin thinking about some kind of alternative career track?
Well, I was, just going way back, I'm probably fairly typical of a lot of veterinarians where, for as long as I could remember, I was interested in being a veterinarian. As a kid, I was focused on dogs and cats. I had a stuffed animal collection, and every one of them had a name and a medical chart, and they got their vaccines, and I had my sewing kit to, when they got injured and had a tear, I'd stitch them up, and I actually talked about that in my application to vet school. But even before my application, I already had a hint that I was moving toward research or public health. I had done some work as a vet tech or volunteer, and eventually paid positions in a small animal and equine practice, but it really wasn't rocking my boat that much. And in my pre-vet classes, I was not that excited about them, so I started looking for a different type of major, and because I collected insects as a teenager, I took an introductory entomology class, which then opened up a whole new world to me of medical entomology, public health, and there were veterinarians involved in that. So yeah, when I went into my first day of vet school, I already had a pretty good idea that I was going to be going into the public health angle, and UC Davis at the time had a great program. They still have it, the Masters of Preventive Veterinary Medicine, but back then you could do your master's along with your DVM at the same time. So that saved quite a bit of money too, doing it at the same time. So that's my long story of how I evolved into that interest.
Yeah, I actually did a combined degree program at Tufts too, where I did the MPH at the same time as the DVM, and yes, it's definitely nice for the cost savings, but does just add to the academic load. So you have to be sure that you're going to be okay with that at the same time. And I know a lot of people who have done the MPVM at UC Davis just after graduating from vet school, and I know that's opened a lot of doors for them. So it's cool to see that was also something that played a role in your career.
Yeah.
So after vet school, what did you go into from there?
After veterinary school, I actually did want to get private practice experience. I felt it was needed, especially since I was really, at the time, I wasn't thinking about an academic career. I was thinking more of a government public health career. And I had met the State Public Health Veterinarian at the time through the MPVM program, and he became my model, the ideal job. And so I wanted to go that way, but I also knew if I was going to do a rabies program and some of these other, looking at these issues that cross over with food animals as well as pets and wildlife, that I felt if I'm going to interact with veterinarians, I should be one for a little bit, or at least in the classic sense. Mm-hmm. So I wanted a unique experience and got it. I actually accepted a position down on the Mexican border, east of San Diego in the desert near Yuma, Arizona.
Wow.
Where it gets to be about 120 in the summertime.
Yikes.
Gorgeous in the winter.
Uh-huh.
And that was a mixed practice, and it was mostly, I saw mostly small animals, especially chihuahuas. That was the demographic. But I did do some feedlot work in preventive medicine, helping monitor antibiotic residues and withdrawal times before they left. There's a lot of feedlot activity down there, and a little bit of relief for the equine vet in the practice, as well as I did some 4-H animals. And I only stayed a year. I did find I was still very intent on getting into the residency program with the state health department, and my boss down there really tried to get me to stay because it was such a rural practice. It's hard to find anyone.
Yeah, that makes sense.
The middle of the desert. And
Okay.
we were working in a very low income area, so you didn't get to do all of the, if there was something exciting happening, it went to San Diego if the people had money. But I did find it a little stressful in that coming right out of vet school, I didn't feel fully prepared. So in terms of like surgery and experience, and I weighed it back and forth. I think there could have been benefits staying a little longer, but I scooted on out of there.
Okay.
With the beginning of my government career.
Okay.
But I'm really glad I did it, though. I got a lot of grit, and very memorable experience, and I'd highly recommend for those who can to go through private practice, even if they think they're going to go into an academic or government career.
Okay. Yeah, I think that a lot of people feel that way. They kind of think that after 4 years of vet school, I want to make sure that I feel like a real vet, at least at some point in my career, and I want to be able to treat my parents' dog's ear infection or whatever, and you might not feel quite ready for that just out of vet school. And so I think I've found the same thing being in the Army, even though my clinical experience has been stretched out now over 3.5 years, probably the same load as someone might get just in a 1-year rotating internship or something. I've now gotten to the point where I am pretty comfortable with a lot of the typical small animal medicine and surgery stuff, and so I think that no matter what I do in the future, I'll always kind of feel like, yes, I'm still a real vet, and I can fall back on that if I ever needed to for some reason. And so I agree that that's nice, but I also think that there can be a risk in people going into that job or that internship just saying, I'm just going to do it for the experience, and then kind of continuing to get sucked into that world. And not that that's a bad thing, and we need regular clinical vets, and it's awesome that a lot of people want to do that. But for someone who had this passion to do something different, then I think it can be easy to kind of get caught up in the security of making a salary and doing something that you know, rather than branching out again into something new and scary. And so that's something that I'm hoping these interviews will help people to see, is that yes, it is nice to go ahead and get that experience, but it's also possible to make that jump then onto something else like you did.
I think it's good to have a plan, and I did have a plan. Like I said, I was thinking more of staying at 2 years, but it depends though too. Sometimes you get done with your master's and a great opportunity comes in a different area, and so you got to jump on those, since they're sometimes few and far between. It did have an opportunity to go straight out of DVM or a master's and go into a food safety or a public health type position.
Okay. And so what did you go into from the private practice year?
Well, after private practice, again, going back to when I was in my master's, they always would have people from different epidemiology professions come and speak to us and to give us ideas of what kind of careers. So somebody, food animal practitioner that did herd health would come, the state veterinarian from the Department of Agriculture, and then the State Public Health Veterinarian from the California Department of Public Health came, and that I was really excited with what he was doing. He was running the rabies control program, doing bubonic plague surveillance in cats and dogs and coyotes, working with wildlife services, and also doing a lot of work that was more human health oriented. Really the ultimate goal when you work for public health, you are actually it's the health of the human community, and the animals are more to do with how do you make sure that you're not having any problems, and that you're doing preventive measures for some of these zoonotic diseases. So they had a program called California Epidemiological Investigation Services, and that program was specifically created for veterinarians, PhD, EPIs, MPH type people that would get a year or two of training hands-on in a local or state department, and then with the idea of building the public health workforce in California. It was a very dynamic, active program. At the time, that would have been in the early 90s when I went into it. Unfortunately, with our budget cuts, it's down to bare bones now. It still exists, but and I like to think that these things go in waves and it'll come back, but it's not. It's still out there, but it's a lot harder to get a position specifically in a veterinary role. A lot of the positions are more like environmental health or chronic disease, some of the areas that are getting more funding, which I definitely see veterinarians go into. But I did that residency for a year, and I was very fortunate to get into that training.
Okay. And so did that open the door then for your next real job after that?
Yeah, what you learn in that program was geared to teach you basically how to get a state or county job, and it's very different. It's not typically that you look it up in a journal or in a trade newsletter. You have to often get on a list. So you take a test, and which might be a written test or an interview, then they rank you, and you're on a list, and it can be really confusing to figure out how to work that system. So I learned, I got on the research scientist list, and took my first job, basically staying in the same office, but I transitioned from the residency program into the research scientist series in the vector-borne disease section.
Okay.
And that section was just getting built up, and there were a lot of regional biologists and a lot of exciting things going on at the time, like the emergence of hantavirus.
Okay. So what did some of your day-to-day work with that actually look like?
That work was, I did a lot of interfacing with our regional biologists that were conducting surveillance in wild rodents and fleas for plague.
Okay.
And in that plague prevention program, basically we do surveillance, especially in the spring, summer. If positive animals or flea pools came up, and the campground, we'd mostly look at national parks, state parks, and campgrounds. And if there was positives, then the campground would be treated with flea powder, basically, possible rodent control, and possible shutting down or temporary shutdown, especially, when you had a lot of kids coming in. We would see an occasional bubonic plague case, especially among campers.
Wow.
And
Okay.
so the plague program was big, and I did a lot of the data, managing the databases, and this was kind of similar work, but when we had our first case in California that was fatal, and the outbreak was happening in the New Mexico Four Corners area, the Southwest, and it was eventually discovered that deer mice were the vector, and these were aerosols from their feces and urine. So I did a lot of the investigations when we had human cases. So I'd go out and trap the rodents and take blood samples and do the monitoring, and also work with local mosquito and vector control districts that were doing their own surveillance in rodents. And I eventually wrote a paper summarizing all of our statewide data while I was in that position.
Huh. Okay. So did you become an expert at handling wild rodents and getting blood from them? Or I did that for one summer and still had a hard time getting the blood sample. We were using the little pipette to the conjunctiva of the eye to get a little blood sample, and I did get bitten a couple of times, unfortunately.
Yeah. I got good at dumping them out of the trap and into the bag with the anesthesia.
Yeah. Yeah, that's the hardest transition.
Carrying things like chloroform, and then now it's gotten harder. I think they're using injectables in the field now. Mm-hmm. But our work was pretty much all lethal, and so I just had to get a heart stick. I did a little bit of I did participate a little bit in a the interesting survey on the Catalina Islands, which are off of Santa Barbara County, and they have their own subspecies of deer mouse, and some preliminary work showed that those mice had really high percent positive of C. nombre virus, like 50% and up. And so one of the UC Davis researchers got a grant, and I actually got to go out with him and do some trap and release where they did do the capillary tube method of getting the blood sample.
Okay. Huh. And so eventually you moved from the research scientist position to actually becoming the State Public Health Veterinarian, like the mentor you had known in the master's program. So how long did that take for you to progress up through the State Public Health veterinary ranks to that position?
Well, I did have a detour in between, and I was encouraged actually by my original mentor, Larry Barrett. There were a lot of opportunities for management positions in the state, particularly back then, and veterinarians were being, mostly physicians, but veterinarians were being utilized in a lot of state health departments in important positions like state epidemiologist, and so that interested me, and one of the veterinarians that worked at the county, Mark Starr, he had been chief epidemiologist of Sacramento County, which is about 1.2 million, and he wanted to move over to the state, and there's a lot of swapping like that goes on. So his position opened up. He went over to the state to work in the veterinary public health section, and I took his position at the county. I did that because I wanted to supervise people and get some of that management experience. And also the county is interesting because you do everything. So I had, AIDS surveillance, maternal and child health, child death review team, environmental health, foodborne outbreaks at prisons and in jails and schools. And it's just that you work side by side with the health officer. I thought that would be that was another really good experience. And I did that for years. And,
so what did you feel like your reception was like as a veterinarian working on those more explicitly human health issues? Were people sometimes wondering, what is a veterinarian doing here involved in this? Or did you feel like they treated you just like any other public health expert?
I would say overall, and it helped a lot that I came in after Mark Starr, who was very loved and very, very good in that epidemiologist position. And in California, veterinarians going through the MPVM program have a good reputation for, having the right background and the right training to step into a position that is maybe more human health oriented. There, with the physicians, there can always be some, they definitely see themselves as we might be doing the same work, but they hold a higher rank no matter what. Yeah. That's the nature of our society, and they will get paid more. For example, at CDC in their training programs. But overall, it was fine. When I was going to hospitals and doing, AIDS surveillance, it generally wouldn't come up that I was a veterinarian. I was really utilizing my statistics background and public health training. And I have to say, I wanted to go back into that. And so ultimately I did go back to the state where I felt I was using more of my veterinary training. Eventually, my boss promoted up, and I served as the State Public Health Veterinarian after he promoted way up high into management at the state.
And you did that for 4 years?
I did that for about 3 years, and then lo and behold, an opportunity came up from one of my previous mentors who was over at Food and Drug. He was a division chief, and he approached me. He had a position, and he said, if you come over here, it was a different division, so you come over here, we'll sponsor you for a PhD at UC Davis. And I said, I couldn't pass that up. And I had to leave the vector-borne mosquito diseases, but and go into food safety, but from the beginning, I'd done some foodborne outbreaks, and I found that the foodborne pathogens interesting. So I moved over to Food and Drug and started a microbiology PhD at UC Davis. I really, again, I wish in a way I wasn't so inbred. I had my bachelor's, master's, and PhD all from the same university, but that's the way the funding and the circumstances worked out. So I don't.
Maybe could you just tell us about some of your favorite experiences as a public health veterinarian, kind of when you look back and say, wow, that's really what I love doing and hope to continue doing with my career?
Well, I can say that within my first week of joining the veterinary public health section at the state, I was hooked. I was about 3 days in, and I had just gotten my little cubicle set up, and it was July of 1993, following right after the Jack-in-the-Box outbreak of E. coli 0157, and that was winding down, but the communities were on high alert about E. coli 0157. It had hit the map, and we got a call. The way it works when you're in state communicable disease on the human side of things, typically there's a duty officer, and in California, all the public health officers, they run the counties. We're kind of a bottom-up state. So when something happens at the county level, and it might involve multiple counties or something that they need assistance with, if it's a small county, they'll call the state on phone duty. And so we got a call on phone duty that Mendocino County, Fort Bragg, it's a little tiny coastal Northern California town, had multiple cases of bloody diarrhea coming back as E. coli 0157. And so within the day, I was packing a suitcase and reading up on what to do with 0157 and heading out there with one of the veterinarians in our section. And so we drove out to the coast and met with the health officer and went door to door with fecal cups and also collected hamburger. They had implicated hamburger meat. It was over the 4th of July weekend. So we collected hamburger meat, we collected stools. Sadly, one of the elderly patients did die, so there was a lot of intense media locally on what was going on. And the outbreak strain was 6 months later, the PFG was done and it was found in that ground beef. And we wrote that up for CDC's morbidity and mortality weekly report. But I just thought that was really exciting, just to, suddenly pack up and go on these investigations and actually find what happened and be able to come back to the community and say, you need to cook your hamburger well, and go back to the industry and say, your hamburger has a problem. It's coming in contaminated. So that was my introduction. And the next thing that happened within months of that was the emergence of hantavirus. And I went out on the first investigation in Mammoth Lakes, California, and the U.S. AMRID, hopefully I say this right, the Army Medical Institute in Infectious Disease Research.
Yeah.
Something lines anyway. They brought their teams with the whole bubble suits, and because this is a respiratory virus with high case fatality, I was asked by one of the biologists that was going down. He said, "Oh, you want to join me?" And my boss was out of town, so I just did. And I can tell you he was not entirely comfortable when he got back and saw me wearing a bubble suit with a respirator, which is still on the MPVM page, I think, that photograph. But I wasn't going to miss out on it, and I figured I was in good hands with the Army for the personal protective equipment. So we actually took a lot of rodent specimens, and those got shipped back to Fort Detrick, and they had the first rodent isolation of C. nombre virus. They were in kind of a hot competition with CDC, which is portrayed a little bit in that movie Outbreak. They have they're scientists, and CDC in the meantime it was isolating this, the same virus from humans. And it was interesting because it went through a lot of different name changes, and eventually it was called Sin Nombre after a lot of fighting of who got to name it. Sin Nombre is the virus with no name.
That's funny.
I think with that no one could agree on the name. Really a big highlight. And I continue to do those investigations and really feel like some of the work we did showed that the highest risk was indoor exposures and making aerosols. And so we came out with concrete recommendations to wet down, don't use vacuums, and create aerosols when cleaning up mouse infested areas. You want to wet it down, you want to, snap trap the animal, clean up the area safely. And in some cases where there's heavy infestations, like utility companies, their workers that have to go into these utility buildings sometimes have heavy exposures, and so they've taken a lot of measures to protect their workers. And I felt like what we were doing, even though the virus was incredibly rare, we were, preventing illnesses through that work. And kind of similar to I also say one other example, the other huge investigation I worked on was the 2006 E. coli 0157 from baby spinach that was growing in California and sickened over 200 people across 26 states and Canada, and there were at least 3 deaths, and it was a huge story in the media. There had certainly been prior spinach outbreaks, and other bag salad greens had problems, but it sort of was under the radar until that outbreak happened, and they, it caused an unprecedented period of time where the public across the board, all the way across the country, were told not to eat fresh spinach, and you literally, it was gone from the store shelves. Nothing like that had ever happened with a produce item. And I was in the PhD program, but still working for the state at the time, so I got deployed with the field team because I was at the time in food and drug, and so they were the ones doing the farm investigation. And so I spent about 6 weeks down in the Central Coast, basically hunting on these farms for where the bacteria came from. And we were paired up. We were in a group called CALFERT, California Food Emergency Response Team. So I was a team leader on that, and then I was paired with a food and drug administrator team leader. And so we would do the investigation jointly and collect. We ended up, as a group of over 12 of us, collecting over 800 samples. And we found the outbreak strain on one single farm where only about 2 acres went into the lot. And that farm, we found it in nearby grass-fed cattle that were on the same ranch. They were set back, though, and it was dry, so there was no runoff, so we couldn't explain the cattle as the direct cause. Then we looked at wildlife. There was a large population of wild pigs, and we found the outbreak strain in the pigs, but the farmers denied seeing the pigs actually in the field, so we weren't certain. We thought that was a plausible explanation, but we couldn't say definitively. We didn't find the bacteria in any agriculture water. It was a well, but we did find it in surface water and had concerns that, the pigs were wallowing, the cattle were defecating, and maybe the well got breached over the summer. And so it was, I thought it was an incredible investigation. Even though we didn't say the exact source, we certainly found multiple possibilities that the growers could then incorporate into their metrics, which they did. And that resulted in the leafy green marketing agreement. There's still some outbreaks, but nothing like that one. So that's that. After that outbreak is when I moved to the university because I wanted to do research on these. The opportunity came up, and I wanted to. You always finish an outbreak. They're very exciting, but you never get to keep researching what actually happened. And so that's what I.
And so do you feel like getting involved in that kind of stuff that has real human health and economic implications is kind of personally fulfilling to you? Because I think that's what a lot of people in my generation, maybe especially, are looking for, is something we want to really make a difference with what we're doing and want to get involved in something bigger than ourselves. So I think that kind of thing is something that can be exciting for those reasons?
Yeah, I'm definitely drawn to that. I really like the high profile, feeling like you're making a difference, working with, industry. In something that is very much in the public eye. I enjoy that, and I enjoy the communication that comes with it. It's different. I always knew when I did the PhD, I wanted to be applied, and so I'm probably never going to get the great big NIH grant to study, a very specific disease factor and that type of notoriety. But I think that for me, the applied work is what's really exciting. And I am a little bit, I want instant gratification. So I love grants that are fast and you get the recommendations out. I do a lot with Center for Produce Safety and some of the USDA grants where, within 2 or 3 years, you've come up with some recommendations versus the type of long-term research that might take 20 years in other fields.
Okay. Yeah, that makes sense. Nice to see results coming more quickly. So that's some of the...
are needed, but for me, that was my traction.
Well, so those are some of the things you really enjoy. Are there some things that you don't like as much about your line of work and that you think people should be aware of when they're considering that type of career?
Well, the funding is, that can be stressful. That was bad at the state. Part of why I left the state was that I didn't mind the furloughs per se. I felt like the salary was okay. I can live with a Friday off here and there. But what I was very unhappy with is that we no longer had funding to do things like the DNA fingerprinting. I don't think you'll see another, at least not in any current time, another response like the spinach outbreak. In fact, we know other outbreaks have happened and there hasn't been that kind of response with leafy greens. Lots of people retiring and they never fill the position. So, I actually felt when FDA created the Western Center for Food Safety that even though it's soft money that goes year to year, potentially it's a 5-year grant, but you still don't know because it's the government.
Okay.
So every year you have that moment where am I still going to be funded? But with Food Safety Modernization Act, they've been really good with doing applied research to help have informed science-based preventive controls and produce safety on the farm, things that make sense. And so yeah, when all that said, it is a constant. I'm 100% soft money, and so at some point, food safety may not be big, and I'll have to think, okay, what's next?
Okay. Yeah, well, speaking of the money, could you tell us a little bit about how you think your salary has compared to other types of vets, other classmates of yours? Do you think that you've been able to have a similar type of lifestyle, or maybe you could talk about how the hours and the working schedule and stuff also kind of plays into that?
Well, I can give my experience, which of course I started this, in the 1990s, so things have changed, obviously. When I first went into that California Epidemiological Investigation Service residency, it's now called a fellowship, but it had a flat stipend, no benefits, and it was $36,000 at the time. I believe it's currently up in the 40s. And being in academia now, I can say in the 40s for residencies, probably a little lower, but not a ton lower. In fact, I do see postdocs are getting paid in the 40s, not uncommonly. So for right out of vet school, right out of practice position, it's probably reasonable. The lack of benefits wasn't good. I actually got AVMA's insurance and benefits at that time, which was a good deal.
Okay.
But I was anxious to finish that and go into a benefited position, which is one of the major personnel side, that's a benefit of doing government work. And so, all of my positions through the state and county had full benefits, and have since rolled into retirement, and that's a definite plus. In general, government hours are pretty predictable. 8 to 5. Because I did outbreak investigations, that was different. Sometimes I would work long hours or work over a weekend, but to me that was exciting. That was great. In fact, my competitive side would be I was willing to work holidays, and so sometimes I got lead on outbreaks that others that needed to be with their family did not get. So. Okay. That can be an individual decision to some degree. Some of the positions you inherently are going to be needing to come in after hours occasionally, but for the most part, it's when I was in private practice, I had some weeks that were probably 80 hours because they hired me to be a relief, and so with the emergency after hours, it was brutal. So that the state was not like that. The county was fairly predictable, Monday to Friday. Academia it's a lot more hours in academia, a lot more because of the pressure to publish. There's a lot of weekends where I just feel pressured to work on papers that you can't get done necessarily during the day because you've got to write grants or something else. So. Okay. Pay-wise, I did go up over time. My first state position was probably in the 40s, and then when I went to the county as a management level epidemiologist, I got around 60,000, which I thought was good at the time. I don't know that that's changed that much. One of the issues with the county is that generally those positions don't require a professional degree, so they're setting the salary based on a probably an MPH level person that they're expecting for that position. And at the state, it can be a little bit that way too, because PhDs don't always get, especially today, don't get paid as much in the government level at the state and local side. So when I left the state, I was probably around 90,000, and I'm a little above that right now. At the university, since I went into a faculty position, I was less before getting a faculty position. But in the federal government, I'd say the potential gets higher. You can get up into the above 100,000. As you go up in higher management, especially in FDA or the federal level, you might even top 200. I'm not sure, but that's not very many people go that route. Usually you're going to be at a different, you're not going to be at that level of Michael Taylor or the somebody who's at the top of the food chain. If you get there and you're interested in high level management, there's some probably hefty salaries out there. Still not my background. My father was in retail business, and I will never approach his salary in this profession. So that is a reality.
Well, so do you miss working with animals as a vet, or are you okay not having hands-on animals now, 20 years post vet school?
I just really don't miss that. I knew, my short time in practice, like I said, I'm glad I did it, but even starting vet school, I knew that that particular routine and lifestyle was not what I was looking for. And today, the veterinarians I know, and small animal in particular, are under so much pressure for the, money in terms of, the clients are always feeling like they're being charged too much. And that's to me a hard stress that I don't miss being involved with. I have a different type of soft money stress at the university, but I just, that interface with the clients and having to deal with the, whether or not they can afford the care or not, I don't regret not doing that. But I do, I'm still an animal lover. You saw me on Twitter, but I have my own hobby farm, and I mentor some vet students that are really interested in the hobby farm. And so I, now have, my husband and I have 15 acres, and I have my 2 horses, which are Arabian endurance horses, and I actually get to live with them now. And my goat herd went from 2 goats to 16 goats because they're very prolific. I tried to keep a buck, and I did not succeed in avoiding everyone. He's neutered now. But I'm hoping to get milk this year and make cheese. I did a little bit of that last year just for fun. And I've got backyard chickens that are very dependable egg layers, and honeybees. We have about 6 or 7 honeybee hives, which are a lot of fun. And of course, lots of fruit trees and garden vegetables. And we have a small vineyard that birds ate last year.
But you actually have time to somewhat care for and enjoy all those animals?
Yeah, I have to commute. I have a very long commute because, Davis is about an hour away. But it's worth it. Yeah, it's something I've always wanted to do. And it's interesting because in food safety, there's more and more of this interest in local foods and home gardening and keeping your own goat or keeping your own chicken. And by actually doing it myself, when I go to do extension or to, educate people that are amateurs in this area, having done it, I can recognize some of the challenges. Yeah. And, that's good. And let people know about that. It's not as romantic as it seems, for example, to keep a milk goat.
Okay. Yeah, I know that's one thing some of the vets I've talked to who have done a number of years in private practice sometimes have talked about that stress of always dealing with clients, and also the longer schedule demands and things that make it hard to actually enjoy working with animals or have their own pets at home and stuff that they can enjoy. And so I know that I've talked to people who have wondered if a career in public health might actually give them more of the lifestyle that they always kind of imagined of being able to have a more regular routine of a job and also have a home life that they enjoy.
Oh, I think that's definitely an appeal. And, the benefits, the generally predictable schedule.
Well, hey, I really appreciate you spending all this time talking, and I know that there's a lot to think about for me as I wonder about my own next steps, and for other listeners and viewers of our interview. So, as usual, I'll have an article on the website with links to some of the different organizations and things that we've talked about, and more information to people follow up, and I'll let people know how they can find you online on Twitter and stuff too, if they have any more questions. And that will all be at my website, which is www.elliottgarber.com. So thank you so much, Michele. Great talking with you, and we'll have a great day.
Great, you too. Good luck.
Thank you. Bye-bye.
Bye.